How's it guys? Dr. Pete here. So in today's video, we're going to try something a little different. I'm going to react to some funny animal or vet memes and let's see if we can all have a good laugh together. Alright, let's go. The pug. An intelligent, docile, adorable, fun-loving member of the toy breed family. Unless it's nail clipping day. In which case you will need the help of 6 other adults, a sedative and an exorcist to control the beast. And that face, yes, this is science. I don't know what it is about dogs, but they are very sensitive when you touch their feet. And trying to clip nails, especially if it's like black nails, it's very difficult to see how deep you need to go. And sometimes we do clip a bit too deep and that causes bleeding. And the dog will then associate that with pain, and then the next time we need to clip the nails, they tend to be very aggressive and they kind of freak out. And this is where I often need to call in all the nurses and the reception staff and the kennel hands and all the vets to just kind of pin the dog down to clip the nails. So yeah, they can become quite a beast. Canine Anatomy. What you didn't know. Teeth, tongue, throat, spring-loaded flipper for pill expulsion. If you ever try to pill a dog, or especially a cat, you can relate to this. I don't know how they do it, but you can try and put the pill all the way down its throat, almost into the colon, and they will still be able to spit it out. And we kind of learn how to work around this. Sometimes we use a little forceps to grab the pill and to put it very deep down the throat. But some dogs just have a way to just whoop, pop out the pill. And yeah, well, I guess this makes sense. I completely missed this in anatomy, apparently. I don't want to vaccinate my puppy. What precautions should I take? Don't get too attached. Ugh, yeah, that is quite true, you know. I've made a video on the pros and cons of vaccination and the controversy behind it. But there are quite a couple of severe diseases that can kill an animal. And some anti-vaxxers that are against vaccinations in humans also spill over to animals. And this is actually quite a dangerous thing. I don't know why everyone in this photo is ginger. What do you think? Let me know down in the comments. What the media sees. Big dogs, small dogs. Reality? Yeah, well, this is actually quite true. People always ask us what type of breed we are most scared of, and you would imagine it will be a pit bull or a staffy or a Rottweiler or something big with a big mouth, but oftentimes it's not these big ones. It's the little small demons. What is this? Chihuahua, Pekingese, sometimes Yorkies. You'd think they don't bite very sore, but once they grab you between the 2 canine teeth, that can hurt quite a bit. And I'm sure a bunch of other vets will relate to this one. This is good. Pit bull owners. There are no bad dogs, only bad owners. Chihuahuas. Yeah, this face looks familiar. I often see this in the consult room where the owner will bring in the dog, the Chihuahua again, and you will start talking to the owner. The dog will be fine, but it will always have this little suspicious look in its eyes. And we kind of learn how to deal with this. This is often the face of, you just try remove my balls. I'll get you back. When you're at a vet friend's party and you don't want to talk vet. Yeah, this is quite relatable. At our university or faculty, we all study veterinary science together, and that's kind of what you do. You eat, breathe and sleep vet science. And when you get to a party, you're not always listed to talk about vet science all the time. But what often happens is when you go to a non-vet party and somebody finds out that you are a vet, then this will also be just as bad, because they always have some sort of dog or animal that they want some advice on, and then that can just kind of ruin your evening when somebody wants to get free advice and you're not really in the mood to talk about it. Thanks for the great medical care. Just kidding, I pulled out my catheter. Yeah, this happens quite a lot. Dogs don't really always understand when we're trying to treat them and to make them feel better. So when a dog needs more intensive treatment, we'll have to put in an IV catheter where we give intravenous fluids and medications such as antibiotics and pain meds. And usually when a dog is very sick, you won't really be bothered by this catheter. But as soon as they start getting healthier, they start to cause havoc. And this is oftentimes when they pull out the catheter, which kind of makes our lives more difficult because now we need to replace it and it's more expensive to the owner. And the dog doesn't know this. It just thinks it's something itchy on the leg. And this can become quite frustrating. My cat's eye looks funny. What should I do? Take the cat to the vet. Is there any kind of cream or something I can put on it? Yeah, there might be. Great. Where do I buy it? At the vet's. You aren't very helpful. Your cat probably feels that way about you. Yes, again, people asking for vet advice for free, usually family members or friends of friends or distant relatives that you haven't seen in years, and that one school friend that you haven't spoken to in decades might send you a Facebook message asking some advice regarding the cat or dog. And the issue of this is we cannot give professional veterinary advice over the phone without actually seeing the dog or cat in a consultation, because we might have an idea of what is going on based on history and if they send pictures, but we can actually get into a lot of trouble when we give advice, especially with regards to medicine and procedures, when we haven't actually seen the patient. And the laws in different countries and different states varies, but this is why you'll often find your vet friend not really being helpful in the sense that they can give you the solution to your dog or cat's problem, but most of the time it's because they can't. And it is always better to take your dog to the vet so that it can be properly examined and that appropriate treatment can be prescribed, and this will just save a lot of people a lot of time and money. But I'm worried about him under the anesthetic. Madam, he will breathe better than he ever has done or ever will do. Yeah, bulldogs. Okay, this will probably offend some bulldog owners because, this is not a great breed. They are not anatomically designed to survive in nature, and thus natural selection would have sorted them out years ago. Again, I'm probably stepping on some toes, but this is the truth. They suffer from a broad condition known as brachycephalic airway syndrome, which consists out of 4 different things that basically narrows down to their flat face, with the nose kind of punched in. It causes them to have a lot of breathing problems, among many other things. And in this meme, the dog is anesthetized and a ET tube, so endotracheal tube, that basically is a patent airway that goes from the outside into the lungs. And this is actually the best way that a dog can breathe because there's no obstruction because of the flat face. You understand? It would appear that your tumor has a dog. Yeah, and I can bet you this owner probably told the vet. No, I only started noticing this about 3 days ago. We do see this quite a lot when animals are brought to the vet clinic with this massive tumor or growth on the side, where you actually have to look very carefully to find the dog's face or its tail or any other extremity. And this is not something that develops very quickly, except if it's an abscess, which then I would understand. But usually tumors grow very slowly over a long period of time, and when it becomes this big, you can't really do much about it. It's too big to resect because there's not enough skin to close. And if you want to go down the radiation and chemotherapy route, that is quite expensive and won't really improve the outcome. So don't wait until your dog looks like this before you bring it to the vet, please. No, we don't actually need anesthesia for dental cleanings. Most pets will just open their mouths and say, ah. Dental, scaling and polishing. Owners do not understand why it is as expensive as it is. Because when I go to the dentist, it costs a lot less. So why is it so expensive in animals? The problem is, and which I'm sure you'll be able to understand, is when you go to the dentist and he says, ah, you are, and you don't bite off his finger. You can't tell that to a dog. It will rip you apart. And they don't understand what we're trying to do, and keeping the mouth open is uncomfortable and dangerous. That is why we have to give a heavy sedation or full general anesthesia for the dog to sleep, so that we can open the mouth and clean the teeth and pull out the rotten teeth if necessary. If we don't do this, the dog will bite down. That will be dangerous to us and the dog, and that is why it is more expensive than you would have expected. Because not only do we need to give the anesthesia, which is expensive, but we need to have someone to monitor the dog at all times. And if you know what a human anesthesiologist will cost, you'll get a better understanding of why we charge what we charge for dentals. Dog owners, My little cutie. I don't think I need to explain anything here. Thanks guys, that was quite fun. Let me know if you enjoyed this, if you want to see another video like this, if you want me to react to some sort of movie, let me know down in the comments what your ideas are and I'll get on to it. And if you enjoyed the content, make sure to give this video a thumbs up, subscribe, and as always, have a lekker day and I'll see you in another video next week. Cheers!